Okay, perfect. Hi, welcome everybody. So my name is Sue Kelly and I am a behavior therapist, and I'm going to get right in because we have a lot of content, and just so that you're aware, there will be materials available to you. Haruka will make sure that there's a link provided so that you can access the materials so that you can read through them after the presentation, okay? So what is mental health? So mental health really is about our balance in our thoughts, feelings, behaviors, and our relationships. And it really does, it includes maintaining that sort of productive daily activities and maintaining, sort of those fulfilling relationships with others and how we interact socially with others. It also includes, being able to manage and cope with daily stresses and having the abilities to adapt to change. Mental illness, when we think about the definition, this is from the Canadian Mental Health Association, and 1 in 5 Canadians will have a mental health issue that affects their ability to participate in activities at home, school, with their friends, and in their communities at some point in their lifetime. And that's pretty high, right? So, there is still quite a stigma around mental illness, and this is why we like to do this workshop and really promote sort of that awareness. So mental illness can take a variety of forms, and it can affect people of all stages and circumstances. For a child or youth, a mental illness might make it very difficult for them to deal with even the simplest aspects of daily living. So making friends, keeping friends, being able to get through their regular routines, waking up, going to bed, trying to get homework done, even just trying to get to school, trying to interact with siblings, communicating with their caregivers, even if it may be participating in other activities. So mental illness can really have quite a profound impact on many layers of your child's life. Mental illness, all mental illnesses are the same. So this is a myth, and that you can tell someone has a mental illness by looking at them. Total myth. The fact is that there are many types of mental illnesses and many kinds of symptoms, and people may show a range of symptoms, but not everyone will experience the same symptoms. And this is where we really encourage people to stay away from things like message boards and Instagram and things like that, because sometimes things get shared on there that it's like, well, this is what my experience was, and this is what my experience was, and people start to think that, well, maybe this was me, maybe this is what I'm experiencing. Everybody is different. We really encourage you to have a conversation with your doctor or with a medical professional if you're feeling like something's kind of not going right for you, or you're feeling out of sync or out of sorts. Really have that conversation with a medical professional rather than conversing with sort of social media avenues. And it's definitely not easy to be a teenager. A lot of mental illnesses really start to come to the surface and be much more noticeable and prominent during the teen years. So sometimes it's really tough to avoid feeling stressed, and pressure can build up in many areas of life, socially, at school, home, and making big life decisions. And the last few years particularly have been very challenging for the teens. They haven't been able to participate in a lot of their sort of milestones, right, with graduations and even, dating, and their social life has been really significantly impacted and impaired. A lot of their independence was taken away with COVID. So hopefully we can gradually start to get back into things. But if we have mental illness that sort of compounds problems, it can really, sort of impact it even at a deeper level. So when we think about maybe anxiety, for example, COVID actually may have played into reinforcing that feeling like that the world was unsafe. So it could have actually made the anxiety even more significant and profound. And worrying about just all of these normal, worrying about all of these pressures are a normal thing. But feeling very, very sad and hopeless and worthless might be a sign that there's a mental health problem. So if you're noticing that your child is not really, sort of connecting or feeling like they have sort of like dreams and aspirations or desires to sort of go on and achieve certain things, that might be a little bit of an indicator that something else might be going on at a deeper level. And mental illness can occur when the brain or part of the brain isn't working well or is working in the wrong way. And when the brain isn't working properly, one or more of its 6 functions can be disrupted. And this is just a little bit of a diagram that kind of outlines what are some of those functions that the brain actually works through. So we have thinking, we have perception, emotion certainly being a big piece of that, because emotion is that sort of trigger that actually pushes the behavioral responses that we get, right? And then we have signaling and we have physical reactions that are thrown in there as well. So some of the symptoms of mental illness can include things like thinking difficulties or problems focusing attention. We can have really extreme emotional highs and lows. So you can get a lot of swinging in the emotional sort of roller coaster sort of ride with certain disorders, right? Where it's like you're feeling like you're hitting into a lull, and then it's like we're doing well, but then it peaks up and then it comes back down. So lots of highs and lows. There's lots of issues around sleep, right? Either sleeping too much, not enough. And these are just some symptoms that are common. And mental illness typically involves changes in a person's thinking, their mood, or their behavior, or a combination of all 3. And symptoms can vary from mild to severe. And the symptoms really depend on the type of the mental illness and the individual, the family, and the environment. So that's a lot of factors that are playing into this. And this, again, is why it's so important to talk to a professional, because not everybody's situation and exposure to their environment is the same, right? So it's not a cookie cutter kind of situation where you're going to get the same diagnosis. There can be lots of comorbidities, which is different diagnosis. Maybe you have anxiety with some depression or different types of anxieties. And it can all be playing off of one another depending on the situation and the environment and the family situation. Does anybody else in the family have anxiety, or does anybody else have a different disorder in the family? What kind of structure is going on in the environment? Is it chaotic? Is it calm? What is actually going on in the peripheral sort of things that are around the child, right? When these symptoms significantly disrupt a person's life, we say that the person has a mental health disorder or a mental illness. And it's because it's really gotten to the point where they're just not able to function. They're not able to do their day-to-day tasks or routines in the normal way that they typically would. Right? So things are constantly getting in the way. They're constantly hitting barriers. They're constantly sort of bumping into walls and challenges that are stopping them, or they're not able to achieve the things that they want to be able to do. I keep mentioning anxiety because it is one of the number 1 mental health disorders that we do face today. So a lot of times these kids are dealing with a significant amount of avoidance. So they're not able to do and participate in the things that they really want to be able to do. Go over to a friend's, have a sleepover, maybe, hopefully now maybe go see a movie, but that could be a really big deal for somebody that is really suffering with anxiety, or even to play on a sports team or join in with others at a park. Again, if you're suffering from anxiety, could be a really big deal. Going back into the classroom come September could be a really big deal for the children that have anxiety issues as well. So again, if it's interfering or disrupting that person's life and they're not able to participate, they're not able to do the things that they would normally do, they're not able to build those same social relationships and have the same kinds of normal sort of routines that they normally would, going to bed, waking up, participating in family life, if they're isolating themselves a lot, oversleeping, undersleeping, something else is going on. And having that consultation with a professional can maybe help to kind of sort out what the next steps might be. So causes of mental illness, and again, so many layers are involved in this. Genetics do play a role. Genetics play a role in a lot of things, especially when we're talking about anything medical, and mental health is no exception, right? So we know that certain genes get passed down and certain sensitivities get passed down. So if you know that as a caregiver that somebody in the family line has had some kind of mental health issue or mental illness, again, is certainly worth having that conversation if you're starting to notice certain types of behaviors or patterns of behavior in your child or teen, right? And talk about, we have some family history. And this can be a challenge, especially if there's been an adoption or if you're caring for a child that is not your own, to try and maybe see if you can get some of that family history. Temperament. Well, temperament can play a role. I mean, certainly we know that 60%, unfortunately, of the population has a difficult temperament. But temperament can be a factor because if we can't sort of get them to that point where they're willing to accept learning new strategies, there can be a lot of resistance, right? So we want to be able to try and tone down the temperament a little bit. We're never really going to completely resolve that because that's part of who they are. That's part of their personality. But if we can teach them some strategies to be able to problem solve and brainstorm with you, then we're learning to deal with the temperament, right? Social factors, again, are there friends? Are there abilities? Do they have skills? What's the family environment? I mentioned about that. Is it chaotic? Is it supportive? Are there other caregivers involved? Where are they at in their development, right? Are they hitting puberty? Because again, we know that some of the disorders seem to get a little bit more ignited once they start to hit puberty. Some when they're younger, but again, puberty seems to be a marker for a lot of mental illnesses. So that might be something to watch for if you're starting to see changes in behaviors as they're developing. If there's been certain traumas, we may see things emerge like post-traumatic stress disorder. And again, is there emotional processing issues? Okay, so again, if we have other factors like learning disabilities or, they're just not doing well in those arenas, that may be having a factor in terms of how they're able to manage their emotions and their resilience, right? So what do we know about the causes of mental illness? Well, the symptoms of mental illness are a result of abnormal brain functioning. And mental illness is a brain disorder, and it's rarely is ever caused by stress alone. So stress is one of those things that we all have stress, and we have to have stress. We need a certain amount of stress to actually survive. So we can never ever completely get rid of stress, but stress is not a contributing factor to mental illness. And so, what do we know about the causes of mental illness? It is not the consequence of poor parenting or bad behavior. So, we want to make sure that we put that in there, because there are a lot of caregivers out there that really take on a lot of responsibility onto their shoulders and accept that, this has got to be me, right? This has got to be my fault. I'm doing something wrong. I've done something wrong. Or they feel responsible because maybe they have struggled with their own journey through mental illness and have fought, some very valiant battles themselves. And they feel responsible that they have now passed this on to their children. So we want to put that out there, that this is not a consequence of poor parenting or bad behavior. Okay, there may be some genetic components, but it is not the result of your poor parenting or bad behavior. Okay, if it was meant to occur, it was going to occur. It's also not the result of personal weakness or deficits in a personality. Okay, so this does not define who they are as individuals, right? Everybody still has that right to be who they are and develop to the best of their abilities and to reach their milestones and to achieve their gifts and to be able to discover their gifts. Everybody has them, and sometimes we kind of bury them away, and kids bury them away, and they get hidden in sort of some of the shame and the guilt that comes along with mental illness. But we want to be able to really pull that out for them and to help them to really discover their gifts. It's not a manifestation of, bad spirits or intent. So there's no hoodoo voodoo kind of stuff that's going on that's causing this to happen, or spiritual, bad stuff that's caused it. Only in exceptional cases is it caused by nutritional factors. Very, very rare circumstances where you would have that come to play. And it is not caused by poverty. This is something that is not a factor in mental illness. Oops. Many mental illnesses do begin, however, in childhood, and they persist into adolescence. So I'm just going to throw this out there that, if any of you, here today, have a mental illness as an adult, chances are you may have started to see the beginnings of that in your childhood. You might have started to notice that there were some changes that were beginning to happen. And some of the common things that we do see, the most common disorders, are things like attention deficit, hyperactivity disorders, so ADHD, autism spectrum disorders, generalized anxiety disorder, again, as I mentioned, is probably one of our most common mental health disorders, along with ADHD. There are some mental illnesses that tend to begin during adolescence. And these illnesses are things like major depression, schizophrenia, bipolar disorder, panic disorder, social anxiety disorder. We sometimes see this in sort of like even 9 and 10-year-olds in social anxiety disorder, eating disorders, OCD, obsessive compulsive disorder, and addictions. So in trying to understand mental illness, it can take many forms, just like physical illness, right? So we want you to kind of think of it that way. And mental illnesses are still feared and very misunderstood by many people. But the fear will disappear as people begin to learn more about them. And we begin to start to normalize that this is just something that is part of the human condition. If you or someone you know has a mental illness, there is good news. All mental illnesses can be treated. And we have such a wealth of resources here in Ontario, and particularly here in the Hamilton area. So all you have to do is just reach out. And again, please talk to a professional. It really is the best course of action. And majority of people have a friend or an acquaintance or a family member who has had a mental disorder. And, it takes compassion and understanding and acceptance. And we need to be able to validate that this is their experience, right? So there's no fluffing this off. It's very real and it's valid. And we need to be there, and we need to provide that support network for people that are struggling through this journey of mental illness. And hopefully we can, be there to be their backup, right? Right, so when you take a look at a child and you look at a picture like this, you say, how would you know a child or a young person was even suffering from mental distress? So some of the signs might be, a decline in school performance. You might see persistent worry or anxiety. You might see refusing to go to school. They may show you that they're having a lot of difficulty with making friends. Oops. Interesting. Okay. Difficulty making friends and keeping friends, refusing to take part in activities, hyperactivity or fidgeting. So a lot of that bouncing around activity might give you that indicator that maybe there's some ADHD stuff going on. Very irritable, mood swings. Again, a lot of those highs and lows that I was talking about. Lack of energy, motivation, kind of really sluggish, maybe sleeping too much. Nightmares can also be something if you're seeing a frequent more sort of susceptibility to nightmares and they're expressing that. If there's a lot more conflicts and they're really sort of getting more agitated, increased temper and aggression, a lot more teary, sad, right? And what is important is that every child or youth's mental health is important. Problems are real and painful, and they can be very severe. Okay, and again, this is their lived experience. And mental health problems can be recognized and they can be treated. And I think that is the biggest thing, is to not sweep it under the rug, to make sure that you reach out and step out and find somebody that you can connect with and talk to. And caring families and communities working together can help. I talked a little bit in the beginning about the stigma, and it really is a negative stereotype that society attributes to people perceived differently, right? And stigma is not the problem of the person with the mental illness. The stigma is caused not by the illness, but by the prejudice actually of society as a result of ignorance around what actually mental illness is, and not really understanding what it is and how it actually truly impacts and affects people. And regardless, stigma may be a reality for someone with a mental illness. This is maybe their actual lived experience, that they're living with the stigma of mental illness, whether it be your child at school, as a parent, having to go in and maybe advocate for your child when you're struggling yourself, can be really challenging as well. So again, if you need that support as a parent, as a caregiver, make sure that you're reaching out and getting the support that you need in order to help your child to be able to have the best experience that they can have as well. It also affects that open discussion, right? So the stigma, when we have that, it really puts up those boundaries and walls, and it gets in the way, and it stops things, and it shuts doors, and it shuts off communication. And it stops us from getting the help and the assistance when we need it. And we don't want to ask and we're afraid to ask, and we're afraid what that's going to say about us as parents and caregivers. Well, if I have to ask, and if I have to, what are they going to think of me as a parent if I'm saying that my child is doing this or they're doing that, or I'm hearing this feedback from the teacher, and what must they think, and I must be a horrible parent, and we go down these horrible rabbit holes. So it shuts us off, and we think, no, I'm just not going to tell anybody. I'm going to sort of suffer in silence. And that's where some of this comes from, is that we tend to suffer in silence. We don't want that. We want you to vocalize. And we want you to talk about what the struggles are, what is the barriers, what's getting in the way, and let's talk about solutions, right? Let's get down to where we can help, and let us know, how can people help you the best? You're the ones that need to be active in your own care. It affects, getting support from your family and your friends as well, right? So if you're afraid to interact and talk with your own family and your friends about what's the best way to manage your child or your youth, how they can maybe best be helpful or supportive. Sometimes when we have, say, even a teenager that's really not communicating with us well, there may be another family member that may be able to step into that role. Sometimes as a I know for myself, even as a mom, that can be really hard, right? To think, well, geez, like they don't want to talk to me. Like, why wouldn't they want to talk to me? Like, but they can talk with their aunt, right? And that's okay, right? If that's where they feel like they can be safe in that conversation, and they're not getting into that struggle conversation with me as mom, that's okay. Because that's a safe conversation for them to have, right? It also affects the morale of the individual with the mental illness. It just drains them, right? They just feel like there's something wrong with me. I'm defective. I'm no good. I don't fit in. Nobody wants me around. Nobody wants to hear what I have to say. So why would I be part of anything? So again, it stops them from becoming involved in the world around them, right? So that stigma really has such a huge and profound effect. So we really need to do the best that we can to try and really break down those walls. I want to talk a little bit about how diagnosis is made. And here in Hamilton, it is either through a family doctor, or you can start by getting a referral to Contact Hamilton or a similar agency, or like I said, through a medical doctor. And usually what happens is that a lengthy history is going to be taken. They're going to probably examine the child, probably to rule out any physical reasons, for any of the difficulties. They may want to do some lab tests, just to maybe check for any other issues that might be going on, if there's any other allergies, make sure that there's no other side effects to any other medication that might be going on, and just check for any other conditions that could be showing or triggering sort of similar symptoms, right? And if there's no medical reason that's found for the behavior, the doctor would likely refer to a psychologist or a psychiatrist who treats children and adolescents. Now, here in Hamilton, that may not necessarily be a referral to the Ron Joyce. It could be to one of the sister agencies that may be seeing kids, depending on the need of the individual child and family. And it really is very, very individual in terms of what type of service. There are group services, there are workshops that might be suggested for parents to take to help them with their education, similar to this. They can really be helpful in providing parents some tools to be able to help interact with their children as well. So there's lots of different steps that can be involved. But if it's an actual diagnosis, chances are at some point somewhere they're likely going to be seeing a psychologist or a psychiatrist or a doctor. So a psychologist is trained to evaluate and diagnose mental illness, because I just want to clarify the difference. And they usually treat using different therapies, okay? So they may do things like DBT, CBT, which is cognitive behavior therapy, or different kinds of therapies. A psychiatrist is more like a medical doctor, and they can diagnose mental illnesses and they can write prescriptions for medications. And they will often have maybe a nurse as well that may follow your child for their medication, but they don't usually do any of the treatment, right? So the actual therapy treatment is usually done by a psychologist or by a social worker. Okay, so often the two will work together to provide a combination of counseling and medication. And the initial diagnosis is based on reports of behavior, usually from parents, different caregivers, teachers, in order to understand how the child functions in different situations, right? So they want to try and get a broad picture, because usually when they use the DSM, which is kind of like a little Bible that they have of the different disorders on different axes, and they have certain criteria that they have to follow and that the kids have to meet in order to get a certain diagnosis, and it usually has to be over a certain period of time and usually over various different domains. So what I mean by that is that it has to be affecting them in different areas of their life. Okay. So, and also often a child will have a combination of two or more behaviors, such as anxiety and ADHD, which is what I referred to as comorbid disorders. Okay. Mental health problems can be treated. I think that is the most important message that I want you to take away from this workshop. And if you feel that your child or teen is very sad, stressed, or worried, it might help to just reach out and, talk with them about how you're feeling and that you are feeling concerned, or that you have noticed that things have changed or that things are different, and maybe just ask them, how can I help, right? That I've noticed that you're, kind of isolating yourself a little bit more, or you're not going out as often. How can I help? Let them know that you're there for them. Maybe provide a number for them to be able to reach out to. Does your child or teen ever? Do they often feel angry or very worried? Do they get reckless things? They could harm themselves or others, right? If they get reckless, do they feel grief for a long time after a loss or death? So does it seem like it's prolonged? Do they think their mind is controlled or out of control? Do they use alcohol or drugs? Exercise, diet, or binge eat obsessively? Do they hurt other people or destroy property? These are just some things that are just warning signs, and know that help is out there. Mental health services comprise a mix of psychological, health, social, vocational, recreational, volunteer, occupational, educational services, as well as when kids sort of, age out, there's also housing and income support as well. So for kids that may go on to be more independent living, there is housing and income support that is provided out there in the community. They can involve a range of activities. So again, as I said, mental health promotion, preventions, mental health problems, treatments of acute psychiatric disorders. So if there's like an acute issue that's gone on, we do have inpatient services as well that can be dealt with. There are classroom situations that can be accommodated as well to help kids, and then try and reintegrate them back in. I think that's what it's all about, right? So some of the help that you can get through various mental health agencies, and again, not a conclusive list, but these are just some of the types of sort of services or treatments that you could expect to maybe become involved with or asked about or, consider, right? Are things like life skills training. So helping them learn some new skills. If your child was involved in substance abuse, there might be some substance abuse counseling, decision-making, problem-solving skills, crisis intervention, right? So there might be some planning around crisis and how to manage crisis. There might be some temper and anger management issues that may need to be dealt with. Group stuff, right? There's all kinds of different groups and individual therapy that, as I mentioned, there's stuff that's also just, for parents as well as the kids. Family counseling and therapy. So there may be some points in time where you may need to participate in some family stuff, some family-based therapy as well as the individual. Behavior management pieces, again, so that may be a little bit more directed at the parents to give you some strategies, maybe how to be supportive. Some psychiatric treatment, so there may be some very specific targeted goals that maybe a psychiatrist may want to focus on. And again, the parent support and training, we have loads of different parenting support groups. We have educational training workshops, webinars, single session, 3 session, 6 session, all kinds of different ones. There are many that are already recorded and uploaded here on your space, and we have many at the Ron Joyce that we offer through our community education program. And then there's also the residential care and day treatment, as I mentioned. We have the inpatient and we have day treatment, and there's all kinds of different programs throughout the city. Hamilton is so rich with services. So there's lots of opportunities to get the service that meets your child's needs. But you want to make sure that you're really active in that plan and involved and upfront and talking about, being active and being involved in that service with your child, so that when they're transitioning back to home, that they have an active plan and you have an active plan, that you feel supported to be able to support them. So the types of actual therapy are things like cognitive behavior therapy, exposure therapy, behavior therapy, DBT I mentioned as well, primarily for depressive kids, interpersonal therapy, emotion-focused, culturally responsive frameworks as well. So there's lots of different kinds of therapy as well that you may come across. And again, not a conclusive list. There are other different ones that some therapists may draw on. So when you think about therapy, you think, well, why? Why do we do therapy? Well, it helps them to really learn why. Like, why am I having these difficulties? Like, it gives them some insight. It gives them some sort of, understanding about, well, what is it that's going on with me? Why is this thing happening to me? And just clearly identifies areas of need and establish those timelines to help them reach goals. So it's really difficult for anybody that has a mental illness to set goals because they feel very overwhelmed. So when you're in therapy, they can really help you to sort of break that down into very manageable bites and help you to sort of really attack some of those, mental pieces that we get into where we kind of stop ourselves, right? And get into those better routines. So we learn new ways to deal with difficulties, right? So challenges, we want to overcome the challenges, right? Start new routines. And we identify, like I said, those negative thinking patterns that are influencing the anxiety and the depression or the sadness or whatever it is that's going on. And we want to challenge those unhelpful thoughts and come up with some alternative helpful ways of thinking. Like, how can I view this differently? How can I sort of, kind of look at this and, sort of step on the other side of it and see it from a different lens? It's not going to happen all the time, 100%. But, if I can start to make a switch and I can start to feel some success, then I can start to say, okay, so that worked that time. Now let's try it again. By doing this, I'm continually building that pattern of learning that sort of problem solving and coping skills, and I'm establishing this pattern that's helping me to feel like I can be effective. I can do this. I can get through this. So the therapy becomes this effective tool that really builds my own toolbox of, sort of ideas and tips and tricks that I can be able to sort of take forward with myself wherever I go and wherever I am, that I sort of have something to sort of draw on to be able to deal with in various different situations. You develop a more positive outlook and attitude on life, right? You start to look at things differently. You learn more appropriate ways of expressing emotions. So especially if you're dealing with like aggression, right? Or if you have like lots of shame and guilt, or you're just not, even if you're very shy, right? And you're not sure of how to express yourself, or if you really struggle with, social anxiety, and you're not sure, like, how do I meet people? How do I introduce myself to other kids? I have no idea what to say. It can really help you with even talking about, well, how do you do that? How do you express yourself to other people? Right? And differentiating between emotions, right? Understanding where are the emotions, and are they high? Are they low? Which ones affect me more? Becoming more aware of my emotional vocabulary. There's a lot to that whole emotional piece. Recognizing my triggers, recognizing, do I actually recognize for myself when I can feel calm? What makes me feel calm, recognizing what makes me feel super triggered and super over the top. I'm at a 10 and I'm boiling over, or am I like maybe at a yellow and I'm just at a caution, right? So noticing differences in emotion and how it affects me and the triggers and all of that can be part of therapy. And the positive changes with the relationships with others. I think this is so prominent that as they start to go through therapy, they start to reconnect with their peers, and they reconnect with their family, and they build those connections, and, they start to rebond again and reform, those relationships, and they start to hear each other, and I've seen it happen myself, where I've seen parents and kids actually, share a tear for probably the first time together because they heard each other for the first time. And sometimes that happens through therapy because the barriers are taken down and they feel like it's a safe place to be able to share and to be able to be heard. And once that connection is formed, it just opens doors, because now they feel like I'm a person and I'm supported. So it really does build that effective way to be able to communicate, and a therapist is able to help to bridge that and help develop that. And it's such a beautiful thing. And learn to identify situations that make their symptoms worse. So I think this is really important too, for them to be able to recognize, this really is not a healthy friendship over here, or this is not a really good situation for me. And recognizing that, this is not, this doesn't go well for me. When I put myself in this situation, it usually goes south. So for teens particularly, to start to recognize that these are not healthy relationships, or these are better for me and these are not, that's a really good thing for them to be able to weigh that out. How parents can be involved. Parents typically participate in therapy sessions for younger children. However, older adolescents and teens generally come on their own, although parents are often included when needed. Parents may help with homework assignments to practice newly learned skills at home. Very individual again. It just depends on the therapist and the relationship with the teen. It just really depends. Stay connected with the clinician. I think that's really important. Understand your child or youth's need for privacy. I think it's important that they feel that they have a safe space to be able to be themselves. Continue to provide clear and consistent expectations for your child or youth. Collaborate with your child or youth about expectations, rules, and routines so that they will work best for everyone. I think, again, when you're talking about having this relationship with your child or your youth at home, this is not about just me setting out rules and regulations. This is about me having a relationship with my children. This is about me engaging in a conversation with them and us figuring things out together, right? Let's figure out the household, like what works best for you, let's have a win-win here, right? Like what do you like to do? What are some chores that you like to do? Well, you probably don't like to do them, but what would you tolerate doing, I guess? And what do you like to do, or what will you tolerate doing? And let's try and figure this out together. It doesn't have to just be, me as the caregiver or parent, sort of laying down the law. And we can talk about, behaviors that aren't acceptable either. And we can talk about that in an open way that says, you know what, hey, this doesn't feel so good when this happens. So, I have to have some guidelines here. What do you think should happen when this kind of thing keeps coming up? And ask them, what do you think are some consequences? And they often are more tough or harder on themselves than what we will ever be sometimes. So engage them in this process, and you're going to find that you're going to have a lot more peaceful communication with your kids, and it's going to be more engaged, and it's going to be a lot more validating, because everybody's going to feel like they've been heard and they've contributed, right? And it becomes a joint household. It becomes a family unit, right? Okay. So really avoid being judgmental. So if you know that they have a mental illness, you want to try really always avoid being judgmental. Judgment is not a helpful thing. Talk about what they find helpful. Respect their limits. I think what's important here with the respecting their limits is acknowledging their successes. I think that is important to say on the reverse side of that. Encourage them to continue taking medications until speaking with a prescribing doctor. So if they're really struggling with a medication, or if they're feeling like the dose isn't quite right, really encouraging them to continue until they're able to have that conversation about making a change. Ensure you have emergency contact numbers and get help for them if it is needed. Don't be afraid to reach out. Encourage them to keep regular appointments, routines, while exploring new interests, right? So I think that it's important for them to have their regular routines, but, step out a little bit. And this is going to become even more common as we're all branching out and coming out of our COVID caves, I guess, if you will, that we're going to have to start to, tread lightly and see where you feel comfortable and start to move forward a little bit at a time. Ask permission to check in with them and express any worries or concerns. So, just say, like, what, do you mind? I'm just going to, check in on you every once in a while and just say, how you doing? You can give me a thumbs up or whatever. Reassure them that what they're experiencing is not a character flaw and that they're not alone. You really want them to not associate this with who they are as a person. It's something that they're dealing with. This is not about who they are as an individual, right? As I mentioned in the beginning, they are still a beautiful soul, and they still have gifts that they have to offer, and they just need to find them and to be able to access them. But this is not about who they are. This is not a mark on their personality. This is not about who they are. Reassure them that this is not their fault. We want to maintain those appointments. If they need help with prescribed medication, you can always get those little kits or get, pills divided up. Some kids really struggle with the taking medication properly, so find out a system that works well. Monitor any visible changes, because that might be good information to pass on to a professional as well if you're noticing any changes. And just gently encourage them to practice the skills that they're learning in therapy, to complete any tasks assigned. And I think what's good here too is particularly around mindfulness or, any calming activities, things like that. Do it with them. Right? Do they see you do these things? Do they see you practice any of these skills? Do they see you get down on the floor and do some yoga, or pull out an adult coloring book, or, throw on some headphones, or, jam a little in the kitchen, doing a little dance before dinner or whatever? Do they see you do any of this stuff to try and chill out or calm down? Or do they see you do a gratitude journal, or do it with them, right? Be that role model that shows that, I'm trying to make some changes too, right? And I'm there with you. I want you to look after yourself, right? So the stress felt by caregivers can lead to a loss of time from work, right? Loss of free time, because this can really consume you. It can put a strain on relationships, for people that don't understand the situation, and it can lead to physical and mental exhaustion. So again, if you need to reach out, if you need to get support, if you need to see a counselor or a therapist, please do so. It is not uncommon to have caregivers have to have their own therapist to be able to talk through their side of what's happening, for them to be able to deal with their own emotions around what's happening with their child. And there are community support groups, there's employee assistance programs, health services, Catholic family services, there's the faith community. Again, whatever feels comfortable for you, right? Schools, again, teachers can do lots of different things. There's lots of adaptations and modifications that can be made. School counselors can be involved as well. So again, this is something that you can have a meeting with at the school to try and engage them in any kinds of modifications or things that can be made for your child to help their situation. Usually there is some student support services, and they can assist with, some psychoeducational testing. If you're involved with an agency, then they may be able to sort of help with some of that as well. And again, the medication question, often comes up though, I don't want my kids to take medications. And I think the only thing that I can say, because medication is not my specialty, and I am not a doctor, but what I can say is that what we promote is to have an open mind, right? Medication can have a profound impact on helping your child be able to reach their milestones. So have the conversation, have an open mind, talk about the options, and explore them. And it takes a while to be able to reach a therapeutic effect, but it deserves having the conversation. To be able to see if, you can have some kind of a profound impact for your child. So there's some questions here as well that you can include for, just asking about medication, right? So how does medication fit with the overall treatment plan? What should we be looking for in terms of side effects? What are the risks and the benefits? How do we know when to stop taking it? Again, these are all going to be included in the handout so that you'll have them as a reference. And then there are some helpful numbers for you as well that you can keep, and some really good websites to reference. And that is everything. And if you have any questions, I will be here for a few more minutes. Thank you so much for being with me today.
Thank thank you so much, Sue. If any of you have any questions, feel free to share.
You're welcome.
Okay. And I will do the wrap up very quick. So thank you everyone for joining today's session. This is a resource page. It will have all the resources from today's session as well as recording as well. Thank you, Sue. And have a great evening,
You're
everyone.
welcome, Haruka.